Do you need scoliosis surgery? There's more than one way to treat scoliosis. Scoliosis can be treated surgically or non-surgically. Those in the path of traditional scoliosis treatment are commonly funneled towards surgery, while modern conservative treatment provides non-surgical treatment alternatives, and the goal is to move people away from surgery. First thing to understand is, what is scoliosis surgery? Scoliosis surgery involves spinal fusion, and spinal fusion is where they take the most tilted vertebra at the top of the curve and they fuse it to the most tilted vertebra on the bottom of the curve, and they fuse everything together. And this is done to eliminate movement or progression, and it fuses the spine into one solid bone. And they do this by using the rods and screws, but rods and screws are only used to hold the spine temporarily, while they use bone grafts to actually fuse the spine permanently. So even if the hardware is removed later on in the future, the spine is still completely fused, and it's fused for life. And I always say there's a lot of things that you can undo in your life, but spinal fusion, meaning scoliosis surgery, is something that's not undone because it's permanently fused. Is scoliosis surgery risky is a very common question I get asked. The very nature of scoliosis surgery means that it's risky in terms of how they do it. Meaning, if scoliosis surgery had no risk associated with, they would do surgery on smaller curves, because nobody would disagree that a straighter spine is always better than a more curved spine. But because the risk associated with scoliosis surgery, they have to wait for curves to become severe before they even consider doing the procedure. So it means they have to wait for curves to become 40, 45, 50 degrees before they even consider scoliosis surgery. So you can have a 30-degree curve, even though we know that's not the ideal position for your spine. They won't risk scoliosis surgery at that point because the risk of the surgery is greater than the scoliosis. So by the very way it's prescribed means that there's risk associated with it, and relatively severe risk. All surgical procedures have their own share of risk. The spinal fusion is a very lengthy surgery, it's very costly, and it's an invasive procedure that's altering spinal function from that moment on. The risk can be associated with many different things, including infection, blood loss, nerve damage, adverse reaction to the hardware that's used. The long-term side effects could include pain at the fusion site. It could be aflexibility of the spine. It makes the spine that's more vulnerable to injury, hardware breakdown where you need multiple surgeries, loss of spinal flexibility and range of motion. So we definitely know that the side effects associated with spinal fusion and scoliosis surgery are relatively significant. So therefore, how can you treat scoliosis without surgery? Well, the reality is that many cases of scoliosis will never require surgery. I mean, it will never become severe enough where surgery would even be recommended, because the extent of the severity or the risk associated with surgery is greater than the scoliosis. Like I mentioned, every curve that's less than 40 degrees more likely would never be recommended scoliosis surgery. And then even cases that break 40 degrees but are not rapidly progressing, normally they're not quick to move to scoliosis surgery anyway, because they know the invasiveness of scoliosis surgery. However, modern conservative treatment approaches integrate many forms of treatment options, and the goal is to treat small curves so they never become severe, make small curves smaller so you're healthier and more function better, and then sometimes even taking surgical level curves and reducing them below surgical threshold. So we can get all three of those types of cases, and we make these cases so they don't ever have to face a surgical decision. And the treatment plans are customized, and they're keyed around very condition. They're normally formulated around very key patient conditions or variables that are going to influence the recommendation. Typically the age, the type of curve, severity, and the location. All these things help us determine exactly what type of care we want to provide for the patient. When we look at conservative treatment, like I said, it's multimodal. It has a chiropractic specific or a functional approach that's going to help reduce spinal curvature while improving function, not reducing spinal curvature while limiting function like spinal fusion. Chiropractic care, we use chiropractic therapy and rehabilitation and adjustments to help make the spine more aligned. We use physical therapy to help increase strength and around the muscles and tissues associated with the scoliosis. We also use rehabilitation and passive therapy, different types of traction, neuromuscular education, vibration therapy to help, again, make the spine straighter. And then we use corrective bracing that helps push on the spine to help augment all the corrective results that we received in the office therapy. And lastly, we use this home rehabilitation and home exercises that are customized scoliosis therapy to help you do a home program to help stabilize the spine. All these things are combined for the person to provide the very best outcome. So when we look at non-surgical versus surgical scoliosis treatments, what are some of the benefits of non-surgical versus surgical. Well, non-surgical treatments definitely are less costly, they're much less invasive, and they're much healthier for the spine, meaning they're not eliminating function, they're not eliminating movement, they're not restricting spinal flexibility. Like I said, it's natural for the spine to be designed to move. That's what it was designed. The initial design of the spine is flexibility with protection to the spinal cord and nerve system. So fusion is contrary to the natural design of the spine. A spine that is straightened through artificial means, meaning rods and screws with bone grafts, is more vulnerable to injury and could be not as strong and be more likely to be have a negative impact or a negative result of some type of fall or injury or car accident. Where non-surgical treatment means that we're working towards corrective results, meaning reducing the size of curve on a structural level, and this optimizes spinal function and doesn't have the near impact on health and well-being and longevity like spinal fusion has. A fused spine will be stiff. It will reduce flexibility and create stiffness, where non-surgical scoliosis treatment preserves flexibility of the spine and strength and function as much as possible. And of course, if spinal fusion is unsuccessful, there's really only thing that, or a complication happens, there's only one thing left for you to do in most cases is more surgery. Where if conservative treatment isn't unsuccessful, you can always move on to spinal fusion. So spinal fusion should be considered like a last resort kind of thing. However, in traditional treatment options, normally nothing is done until the curves become severe enough, and now they start considering surgery. So nothing is done, oh, the curves become so bad, now let's start considering surgery. Where we look at other options before the curves become severe, therefore we can open up a whole world of possibilities to prevent curves from becoming into this severe stage. In addition, I also have patients that have relatively severe scoliosis, meaning 70, 80, 90 degrees. And we were more than likely never going to get their curve below surgical threshold. But these patients still elect not to have surgery because they are concerned with the impact scoliosis surgery will have versus the scoliosis. So therefore, we treat these patients because they prefer not to have scoliosis surgery and prefer a more conservative treatment option. In either option, the conservative treatment of scoliosis needs to be customized. And we're trying to preserve spinal flexibility and movement. We're trying to preserve function and reduce the curve. We're trying to achieve both those things as best as possible using the methods that we mentioned. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.